Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Washington Post this Monday, and I thought I should share. Uh, I say one of the best ones for the last, but the first one talks about something we talk about all the time: diet changes you can make to reduce cancer risk, according to a cancer specialist. And none of them are anything that's new for us, but I just thought I'd share them again because we talk about them almost every Thursday. First, they emphasize eating your fruits and vegetables, pointing out that that's the key to lowering cancer and cardiovascular disease. That the more you eat of cabbage, cauliflower, broccoli, Brussels sprouts, and turnip greens, uh, and the more fruit you consume, the less cancer and the less risk of cardiovascular disease you have. So this is nothing new, something we emphasize all the time, but something that I thought we should remind again. They also emphasize about uh, prioritizing whole grains such as brown rice and oats and quinoa, and how the more you eat of whole grains lowers the risk of dying from any cancer by 6%. Then the commonest of all is the avoiding red meat and processed meats. Uh, for every 100 grams of red meat, the risk of cancer increases by 17%. So uh, decreasing the amount of red meat you eat is a good way to reduce the likelihood of cancer and cardiovascular disease. And then finally, they say the sugary drinks, the sugar does not necessarily cause cancer, but it increases the risk of obesity and chronic inflammation, which is what uh, exposes you to the cancer risk. So those are the diet changes that we've talked about almost every Thursday anyway. So, but I thought I'd just share that again. The second article, any comments about those? I think not, but if there are any comments, please interrupt. The second article is an article that talks about the 8 healthy habits that can dramatically lower your risk of heart disease. And of course, the first one is uh, recognizing the cardiovascular disease is the leading killer of men and women, not only in the United States, but in the world. And that the first key is to get 7 to 9 hours of sleep every night, because this decreases inflammation and decreases the likelihood of eating too much as well. Second is being physically active. We talk about the 150 minutes of activity each week, uh, along with the resistance exercises that would contribute to lowering your risk of heart disease. Um, I like to add to the 150 minutes of aerobic activity, meditation, because I think that's good for the brain as well. Um, and then eating a healthy diet that we talked about earlier, uh, talking about fruits and vegetables, emphasis on plant-based diet. And then make sure your blood sugar is hemoglobin 1C is less than 6 and your cholesterol is less than 200, the HDL at least, so that managing your blood sugar and cholesterol levels is a good way of lowering your risk of heart disease. And then fifthly, one of the most important of all is taking your blood pressure daily and making sure that it's around 120 over 180. I'm sorry, 120 over 80, around 120, thereabouts, pretty close. And then have a healthy BMI. We know that BMI is not the only thing to it, but you like to be between 25 and 30. Above 30 is obesity, but somewhere between 25 and 30 is the ideal BMI. And of course, eliminating smoking uh, and avoiding alcohol are the other two things that they talk about decreasing your likelihood of having heart disease. Any comments or questions about those things? All of those are things we talk about almost every Thursday. But anyway, that was good for emphasis. Many of you are teachers, and so repetition doesn't hurt. Uh, and then the final article is one that we haven't discussed at all, I don't think, but it's something we need to talk about probably more than we do. And that is talk about planning your death. And they mentioned that there's a group of women who meet every month, and all they discuss is end of life plans. And it's a healthy discussion that helps them to put things into proper perspective because we all know we're all going to die, but we don't often like to talk about it. And sometimes in our cultures, I know my wife didn't want to talk about death because they feared that you would die if you talked about death. But this article is emphasizing the more you talk about it, the more the healthier you're likely to be. Any comments about death conversations, and how often do any of you do that?
I
I can
think it's
speak up.
important.
Go ahead, Janice.
I think it's important. My husband passed at the start of COVID, and trying to make reservations, oh my goodness, arrangements was difficult. And in calling the cemetery, I knew that I had done some pre-arrangements and they weren't picking up the phones. We're closed. We can't do this. We can't do that. Finally, I got a hold of someone. Check your records. I've called in advance. I have some arrangements. She called me back. She said, come tomorrow at 3 o'clock. Don't come in. Pull up. Call me when you get there. And I did. And she came out to the car, paid in full. So at a time of COVID, when you couldn't speak to anyone, you couldn't make these arrangements, and to have it all done, what a blessing. It really took a load off us. So it helped me a lot. So it was one less thing to worry about.
Any other comments? Anybody else who's talks about their death?
I know that, good morning, everyone. I know that my sister and I went to a seminar about it, and that's about it. We went to the seminar. I haven't done anything since. I mean, I got all the articles and pamphlets and listened to all the people talking, but, and I think it's really because this is my second marriage and we have children on both sides, and we just haven't sat down and discussed it. But we keep saying we need to, but we haven't yet. But I do have the information available when and if we do decide to do something.
I told you I want it. When and if what? If what?
When and if we do decide to sit down and do something about it.
I see. Okay. Dr. Perez?
Carol, let my sister Carol go first.
Okay, John and I had already discussed it since '89 when he first discovered that he had liver failure. And we tried it because we didn't know how long, would wait for an organ transplant. But then he started a group in his family called TAMP, where he had everybody to make out their wills and etc. and thinking about their timely. And we thought about beneficiaries. And sometimes when you're on transplant list, and I don't know if anybody else experienced that you get blackballed because they don't want to give you insurance other than what your work benefit factor are. And we stopped doing that because he would always get rejected because he had a transplant. But we talked about it frequently, even who the beneficiaries were, what would happen financially. Went to a financial advisor to advise us about retirement, of how much you can live on, who the house would go to, and etc. And it is wise to do that will. And even right before John passed, we had been in and out of the hospital, and he did make a comment, which was sort of eerie for me, but we were quite frank with each other. He said, because he had sepsis and pneumonia and everything like that 2 months or 3 months before, he said, I thought I would have been dead by now. But we sort of face it. It's somber, but you have to face it about what's going to happen to your mate when you do pass, your homes, which child will get it or children fight over it, your trust. And they're having a lot of advisors now that actually tell you how to put your affairs in financial ways that the government doesn't take it over, besides your will and putting things in trust and having generational wealth. So it's a thing that everybody should have in place. The only thing that we did think about that we forgot to do, that opening and closing of the grave, that can kill you. You can buy your plot and everything. And it's just like when my son passed in 2012, we had a double plot and we had to go and buy another one because neither one of us wanted to be separated, like who's going to be on top of the person that's going to be deceased. But it is something to think about it. And don't put it off. Just go ahead, get a lawyer or someone, or just make it yourself. They have these self things that you get off the internet and your power of attorney. One thing we didn't do, which I didn't have power of attorney, but I just told him I did. Maybe I shouldn't say that on the internet because Darryl's recording it. But the hospitals are, medical power attorney. But those type of things, once you face it, should just go ahead and do it.
With us, we had wills in place, but the biggest piece I always felt was the cemetery. And it turned out before I spoke up, that was very important because it was like they weren't allowing anyone in as though there were not going to be any deaths. And to have that big piece taken care of, that was a blessing. But then we had to fight another battle after the small funeral we were able to have at the funeral home chapel. They didn't want anyone to come in there, only the deceased. And then I said, okay, I'll ride in the car with the deceased, took the driver and him. They didn't want that. And I had to plead for them to allow me to come in. And they said, one car. And the priest rode with my husband in that car. And then the one car was myself, my son, and my grandkids. So, but we were able to do it. And somehow he was a Mason, and he was able to get the final rights that he wanted, the Mason funeral. But they were very strict on that. So I'm saying that to say, you don't know what the situation would be when it turns out that you have a loved one that's deceased and no arrangements made. So having that will and having the cemetery piece in place, it was a big help. Now, we didn't have the funeral home in place, but they were very accommodating, so that wasn't a big thing. Little funny because, of course, at the funeral home, part of that is picking the casket, which we hadn't done previously. And my son and I were walking around, and that's overwhelming and emotional. And we saw this one casket and we said, well, what color is that? Merlot. Late, my husband had started drinking wine every now and then, a glass of wine. Merlot was his favorite. So that's how we chose the casket. So it was just a number of things, but everything seemed to fall in place. But I would advise anyone have the will and have the cemetery piece in place.
And don't forget the advanced directives, because
Yes.
a lot of times we talk about end of life, but we don't talk about advanced directives and whether or not you want to be intubated, whether you want to be on dialysis, whether
And
you want this or that. And I think advanced directives is another component of it that we should not forget as well.
a lot of hospitals require that before major surgery. I know we had to have it.
Yeah, they request it. They don't
Okay.
actually require it. They
Okay.
request it. Uh, Lucy, you're next. Lucy's gone.
Still mute.
I was talking and talking and talking. Y'all missed it. Uh, my baby brother transitioned at the end of COVID. And, with all I know and with, just being in the arena, when it came time for an intervention for my brother that would have only provided maybe days to his life, I would have gone for those days. And there was, a heart machine that they wanted to put him on, and that was my decision. But I am so grateful that my brother, though intubated, was able to raise his hand and say no. I have seen, because of our procrastination and denial, families torn apart because these decisions are not made. I have to say, shame on us. And the wealth that's lost because of this craziness. The wealth.
Thank you for sharing. Uh, John Buchanan.
Yes. You know, I can never remember that term advanced directive. I've got one. I've got a last will and testament, but it's one of those things that fear is involved with me. I don't want to look at it. I'm afraid to look at it. But I remember that when my mother was near the end, uh, maybe a year before she passed, she had Alzheimer's, so that was like very difficult. And we recognized the need. She did not have an advance directive. We went through that thing step by step. And with Alzheimer's, you are there in the moment. It's just like 5 minutes ago, though you're not there anymore. But she could tell us exactly what she wanted. We might have had to repeat the question: do you want to be intubated? Do you want to be on a machine? And those decisions are personal and private. And if they're not handled appropriately, like Dr. Perez said, it can be disastrous. Um, And the other thing, I had to go through that with my mom, not with my dad. And my uncle and my son were cremated. That's another area that people may want to decide for themselves whether they want to open casket or cremation. So thanks. That's my experience.
Darryl?
Good morning, everybody. I had a will, power of attorneys, advanced directives that's set up. I've got a fireproof safe with all my financial accounts and instructions for how to access them. Some of you know um, I'm donating my body to a local hospital a couple miles down from home. And they take care of all the final expenses, so there's no funeral home involved. Because I kind of refuse to pour a lot of money into funeral directors and into the ground by buying fancy boxes for my remains to lay in for no good reason. I'm not even feeding the animals, the worms, the birds. My body is in no useful purpose other than putting concrete into the ground. So I'm avoiding that. And as far as since my body won't be available for open casket or closed casket, or all I need is just a memorial service. They used to do these things at home. They used to have weddings at home. So, I just assume have a party, a memorial party at home, and not enrich anybody from my passing. Because, family, my wife, they could use the money a whole lot more than relative strangers that, we pour the money into funeral directors' pockets and into the ground.
Thank you for sharing. Pearl?
Yes, I guess this is just sort of a comment, because as Betty said, we did go to a seminar, but I remember, well, this was a couple of months ago when I went to my last doctor's appointment. My doctor suggested to me at my age that I should always have a family member come with me when I go to the doctor. And I was just wondering if anyone thought that was a good idea or,
It's an excellent idea.
it's an accident. Because I just feel like I'm fine. I feel like I still have all my facilities and I know what I'm doing, but that was one of my doctor's suggestions.
I think everybody should go with a significant other. Carol?
I have two comments. Now that the first time I went to the dentist and I had that emergency contact, and it's always been John, and now I got to think of my kids as emergency contact. Now I got to let them know all my business, but I have told them all along what's everything, and I'm sitting down with them now to tell them where all my financials and all that kind of stuff. So when on my demise, they'll know where my cemetery and like Darryl says, where the important papers are and where the will is. Because I know one time there was an aunt that we were administrator of, and we didn't find her will until after she had passed and everything, and found out we bought too many cemetery plots. Didn't know she had one because nobody knows where your stuff is. My children already told me they don't want nothing in my house. They just want my house. So all those little dust collecting things, they don't want none of that stuff. So you have to think about that kind of stuff. You also have to think about that crypt. As Darryl said, they want to seal it and get more money from you to keep the bugs and worms out and put it in cement and everything else instead of just putting it in the ground. And like somebody's going to steal you or something. But that's another thing to think about. But the first thing is, for the ones of you that are by yourself, how do you do the emergency contact? And like Pearl said, when you go to the physician, you don't have a mate. Who goes with you? One of your children, or how do y'all handle that?
Well, you should have a significant other go with you. Doesn't matter who that other is. Could be a good friend, could be a relative, as long as it's somebody who you trust and uh, to go with you, because I think you should not go alone. Uh, but
Dr.
whoever you,
Callender, you have somebody going with you.
yeah, my son and my wife used to go, but my son goes with me now. Yeah, yeah.
Janice, who goes with you? I can't hear you.
That's something to think about. It's me. And you're right. With my husband, especially as you know, Carol, both our husbands had years of poor health, and we always went with them. And now it's just me. I'm not saying I'm in great health, but of course, I don't have as many doctor's appointments, just the usual physicals and that sort of thing. And it is important for someone to know your history. And in my case, I feel that someone should be someone other than my son. And most of you know him, and he's great. And he tries to act like a dad, but you know how that is, Carol. And but I have a sister that I share information with. And Darryl is right. I have that fireproof safe and all of that. If you ask my son right now, what's the combination? You didn't tell me, but my sister knows. So you need backup to everything. But going with me, I haven't gotten to that point of having anyone go with me.
Okay, final comments, Dr. Perez, then we'll move on. Oh, Catherine, I didn't see your hand. And Betty, okay, go
I
ahead.
just am wondering, I have I don't have anybody going with me, except when I was having open heart surgery. I did have someone then, but I don't have anyone going with me. But I have allowed my daughter, who is a nurse practitioner, to have access to my health portal so that she can see whatever she wants to read. And she always knows when I'm going to the doctor, so she can go in and review anything on that. So I guess my question is that enough?
No,
No?
no,
Mhm.
she'd go with you.
Okay.
Yeah, well, as a doctor and having seen both sides of the story, it's important to have somebody with you because some of the things that are said to you can cause you to lose, for the moment, your direction, and you will not hear anything else that is said. And so it's important for you to have someone to go with you. And Betty, you can have the last comment unless there's anybody else that I didn't see.
Just a brief comment about what someone said about so many things can happen. Dr. Perez said about so many things can happen, and I, being in church for a long time and associated, I've seen so many different scenarios of things play out that ended up bad for families, as far as losing this or not having the ability to do something. So I should be ashamed of myself for not having all of my ducks in a row. But I do have stuff written down because I'm a writer. I write down everything. So it's written, and my grandson and a friend does know because my husband is not going to do anything. Um, but you know, so I do have, like Janice just said, I do have backup, but I haven't set anything in place per se.
Well, you have backup, but does anybody else know where to find it?
Yes, I have a nice big cabinet right here with everything labeled, everything written,
Okay.
um,
Okay, Joyce, you haven't
folders.
spoken before, so
Yeah, I just want to say thank you for having this discussion and thank everyone for tuning in because this has been very enlightening, especially for me. I've one who have put off a lot of these things, and you made me aware that it's time to stop putting it off and start time to take action. And I have noted that this year will be my year to do all these things. But I just wanted to share one experience with you, guys. And when my mother-in-law passed, and she had all of her paperwork done, how she wanted to be, how she wanted the hospital to handle her last moments. And one of the things that she said that she did not want any rest to be resuscitated, if she should fail. Well, we were there and we decided that we were going to step out a minute and get something to eat. Before we got back, we got a call to have the family report back to the room. Well, she had heart failure, and the staff was in there performing resuscitation. My husband became irate, and he asked everyone to stop what you were doing right now and to leave. In which they did. All of the equipment that was connected to her was still connected when they left. But he called to have a meeting with all of the administrators to let them know what had happened and his feelings about that. So, and I'm saying this to say, things happen, and we just have to be aware of those last moments because if we're not there, we really don't know what is going on. But I want to thank everyone, and I will be making my documents.
Okay, Dr. Perez, your hand is up again.
I was just going to say, have someone who can access your phone, since many of us, besides Betty, have a lot of things digitally. So my daughter can get all the data off my phone, people, all that kind of information. And I think the conversation about having a person to go with you, that it's humbling, but so important.
Okay,
Um,
Kyle, did you have a
Dr.
comment?
Callender, just one thing. There is a way, and everybody should know this because I had a friend that lost her phone. I've done it once in my life, but there's a way to get all your contacts loaded, and you can get a hard copy of all your contacts. Because once you lose your phone, like I couldn't call my beloved brother because I don't know his phone number, and if I lose my phone, I'm up a creek. I couldn't contact Dr. Callender nor Kathy because I got everybody's phone number in my phone, and my memory, it used to be I could remember my phone number when I was a kid, when I lived in Indianapolis. But my phone number in Johns was the only one I remembered. So if you don't know how to do it, get your children, grandchildren, somebody to download all those phone numbers in your contact list and make a hard copy of it in case you lose your phone.
Thank you for sharing. Okay, it's been a great conversation. John, I guess we can start the articles.
I have one other comment about that. If
Okay,
you have the ICE in your phone, have a person that have ICE in front of their name. If something happens to you, the police will look for that ICE phone number in your phone and they'll call that person. It's in case of an emergency. And I don't know if people know that.
thank you for sharing. Okay, this is an article about uh, Reverend Jesse Lewis Jackson, who died this week. And uh, I don't know anybody who doesn't know Reverend Jesse Jackson, who actually they thought that they wanted to have him lie in state, but that was another controversy. But he's probably one of the most famous graduates of North Carolina A&T. Was a presidential candidate and has worked with civil rights seems like forever. And this is an article that the president of Howard University put together, uh, talking about all the different things that Reverend Jackson had done throughout his career. Any comments about your personal experiences with Reverend Jackson?
Mhm.
Do you think he should have lied in state? What are your thoughts? What does it matter?
Mhm.
I personally think he should have been allowed, but under the situation now, I felt like he wouldn't be allowed. So, but I think he should have been, just like Rosa Parks and some of the other people that were not political. But he really was. He had run for president twice, and some of his
Well,
maneuvering and
well,
decisions he made helped us as Black people, but understandably, they wouldn't let him lie and stay at the Capitol. So,
apparently you have to have permission of the
yeah, the
House and Senate.
House, yeah, the House, I think, and that's who denied it.
Mhm.
Right, right, right.
Person, the Senate,
Any
I
other
mean, the
thoughts or
House.
comments about Reverend Jackson?
I would have hoped that he could lie in state somewhere in Washington, even if it wasn't there at the Capitol. He was very active here in Indianapolis because we had a SCLC organization here. So he was here quite often at Operation Breadbasket, and I used to attend there when I was younger a lot.
Dr. Perez?
Absolutely, he should have been there. I don't know if he would have wanted to under this present administration, but absolutely. And I think, if you were going to illuminate Black History Month and the 100th anniversary and the transitioning of the Reverend Jesse Jackson, I'm just it just shouted out the bigotry and racism and disgust of this present administration. It's disgusting.
Well, actually, the president spoke highly of Reverend Jackson. He loved the
He,
opportunity to talk about Reverend Jackson because he hates Obama, but he talked very
he
glibly about
did.
Reverend.
Actually, he did. I think he was talking out of his head just to make points.
He,
He said they were very good friends. I don't know.
Yeah, but he said more about Reverend Jackson than any other black man that I know of.
Mhm.
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 Any other comments about your experiences with Reverend Jackson?
I remember running all over New York City to hear him speak as he ran for president. I just always admired him, his perseverance, his commitment. You know, and he was human. So I honor him, and he has done so much. I think I remember standing on a long line to pay my respects when Rosa Parks was there, Thurgood Marshall, just so many honors And I think from the east to the west, from the north to the south, he deserved that type of recognition.
Okay, thank you. Any other comments? If not, we'll go to the next article. In South Carolina, the measles cases are rising. Almost 90% of the cases of measles are people who have never been vaccinated. And so patients who have not been vaccinated, that certainly is a case for being vaccinated. Uh, but that number keeps rising in South Carolina, and it's the fear of it in other states where people who pass through who had measles becomes a concern. Fortunately, uh, still a small number of states that are exposed to measles, but it emphasizes how important it is to have vaccinations, irrespective of the Secretary of Health's position on vaccinations. Any other comments about the measles and who should be vaccinated and who shouldn't be vaccinated?
Dr. Callender, I didn't read the article completely. Of the people that weren't vaccinated, I guess it doesn't say what race they were or
Well,
etc.
it was very few, but they were people who were not vaccinated at all, and people who uh, had vaccinations at the time they were not giving the proper vaccination. So that close to 90% of the people who got the measles were people who were either partially or not vaccinated at all. But if there's any doubt, the advice is to get vaccinated.
Was it because of choice or the economic level where they were too poor to get the shot?
Well, the price for the vaccine is so minimal, it can't be, it has to be choice.
Okay.
Okay, we'll go to the next article. This is an article that, for the first time, raises an issue that the kidney stones, which in the past were thought not to be associated with bacteria, recent studies have identified that when you did extensive studies, that there were bacteria present and that infection may have something to do with kidney stones. There's not enough research or data on it yet, but this is the first case in which they've been able to identify film of bacteria in kidney stones, suggesting that that is a component rather than just the calcium oxalate stones, but that infection may be part of it. But the whole story, the answer is not in yet, although this raises the question that an infection may have something to do with uh, calcium stones. But we haven't done enough work on it yet to make it conclusive. But the initial work has suggested that infection may play a role in even the calcium oxalate stones. This is brand new information, so we'll see what time delivers on on how important this is going to play in the development of kidney stones. Next article. This is a study that says close to 40% of cancers are potentially avoidable, very much like the article we talked about earlier, that 40% of these cancers, if we dieted right and stopped smoking, stopped drinking, and ate right, and exercised right, we could avoid some of the cancers throughout the world. Uh, Not only the United States, but throughout the globe. Although it's easy to talk about it, it's harder to do because sometimes eating the right foods requires economic situations that are beyond some people. Darryl?
Yeah, I was just reading an article the other day that said the rate of cervical cancer was increasing because women are forgetting to get their pap smears.
Hmm. Yeah, and actually, of course, if they got HPV, they wouldn't even need the pap smears. So, it's here again, the being vaccinated would be a major role in forgetting to get uh, pap smears is almost unforgivable because cervical cancer uh, really should not even exist anymore. If if all the men and all the women in school got HPV, then you'd actually have cervical cancer as rare as measles. But that's not the case. So uh, pap smears are important uh, since all schools do not give HPVs, and the real problem is that too often they're given to women, when in point of fact they really need to be given to all the men because they're the ones who spread it. But not having HPV, the pap smear is mandatory. Yeah. Thank you for sharing, Darryl. Dr. Perez?
Need to give it to children, adolescents, pre-adolescents.
Well, yeah, pre, especially pre-adolescent boys, because the boys, the children are the ones who are spreading it. They're having sex with women, and the women are getting the cervical cancers. And so, yes, but that's supposed to be given in pre-adolescence in school, and it's not being done as it should be done. And as we know, it not only causes cervical cancer, it also causes head and neck cancers in men. Okay, let's go to the next article and see if there are any comments or questions about it. This pulmonary arterial hypertension, which is not a very common disease, but it's a problem when it occurs that is associated with very high mortality rates. And if you don't take the medication, then the outcome is even worse. And this article points out that when you take the medication for pulmonary arterial hypertension, the outcomes are reduced, but it's still a condition that is very difficult to treat satisfactorily. And the uh, outcome, whenever it occurs, requires adherence to medication. It's not a very common condition, but it's a condition when it occurs that requires that you take the medication, very much like any other heart disease, because this is a pulmonary arterial hypertension that's located in the lung, and um, is one of the hardest diseases to treat that I've encountered. Okay, I just wanted to share that. You can go to the next article unless there's some questions about it. This is this is an article that emphasizes that caffeinated coffee does not cause atrial fibrillation. And in some instances, it will prevent atrial fibrillation. And so this whole article talks about the fact that people should not believe that caffeinated coffee has anything to do with atrial fibrillation. This was a myth that was circulated for quite a while, but more recent studies have identified that coffee is helpful for cardiovascular disease, not harmful for cardiovascular disease, and certainly does not cause atrial fibrillation. There was a time when that was thought to be the case, but that no longer is the case. Any comments or questions about the association of coffee and atrial fibrillation? The common heart disease that does require medication to prevent strokes, uh, unless you have uh, unless you have it ablated, in which case uh, it can be ablated. And if it's not ablated, then uh, heparin or those kinds of drugs prevent uh, clots and strokes from occurring. Any questions about atrial fibrillation and coffee? Yeah. So that most of the studies now suggest that coffee is protective rather than causative. Now, this is, I guess we've had variations on the theme on this because we had a previous article about a couple of months ago that talked about a triple pill. This now talks about 4 pills in one as a treatment for blood pressure because cardiovascular disease and hypertension is the cause of death of so many people. And because the problem is that people don't take their blood pressure medicine appropriately. Uh, one of the most important things to do is to have people take a single pill, which may be a pill which consists of 4 different pills. And this then might help us in controlling hypertension. And one of the biggest problems I've found, and as we do uh, pressure studies on patients in outpatient clinics, we find that most of the patients who are hypertensive are patients who know they're hypertensive but don't take their medications. And so it's important to have a blood pressure apparatus at home and to take it once or twice a day and to be sure that your blood pressure is under control, meaning in the vicinity of 130/80. Uh, John Buchanan?
Yes, I had I, I was on several different medicines for hypertension, and previously I had started to get vertigo or dizziness when I stood up. So my doctor took me. I thought he would take me off of that medication, But what he did, he lowered the amount and added another one, a very small. So I guess that's like a poly pill if you could put those two together, so I wouldn't have to take two pills. But when he did that, I no longer had the dizziness when I stood up. So I think that's a good thing. Um, my pressure is managed pretty well, so I'm happy with that. Thanks.
Thanks for sharing. It's so important if you have side effects from the medication that you share with the doctor so you can make the changes that are necessary. Because we now have so many antihypertensive medications that it's easy to put you on medications that can control some of the side effects that some of the blood pressure medication can cause. Any other comments? We're now in an era where we have there's no excuse for having uncontrolled blood pressure anymore. So the only thing that is important is that everyone should have a sphygmomanometer at home so they can measure their blood pressure. Catherine?
I was going to say sometimes it seems to take quite a while for them to manage, or for me, it took a while for the doctor to manage my blood pressure, and I ended up taking, I do have now 3 different medications for the one problem. So I guess it would be, I don't know how they would determine which what percent, or I guess how much of each one to put into one capsule. But it would certainly make me feel better if I only had to take one blood pressure pill instead of 3.
Well, I think that's what the goal is eventually is going to be because the biggest problem in hypertension is the fact that most patients' blood pressure is not controlled, and your point is so well taken that it's important to take the number of medications that are necessary to keep the blood pressure under control because it's life or death.
Well, I admit that I had been non-compliant because of sometimes the medicine would make me sleepy in the middle, when I didn't want to be sleepy, different things like that. So it would probably be better if I only had one to worry about.
And that is eventually, I think, what's going to be the way it's going to be handled eventually because there's so much non-compliance. Carol?
Um, After if your blood pressure gets under control and you're still on blood pressure medicine, how long do you have to stay on that blood pressure medicine once it's under control?
Probably as long as it's under control, you should continue to take the medication. Uh, if you're a doctor, then you and your doctor decide you want to taper the medication off, then you need to do it carefully under control where you get your blood pressure monitored during the day so you know that it stays under control. Because the issue is not once that you get it under control, but that it stays under control.
Mhm.
Well, what if it goes too low?
Well, just as she mentioned, as Buchanan mentioned, if it goes too low, then you need to modify the medication so it's at a level that is not associated with uh, vertigo or when you stand up, the blood pressure drops. So the ideal is to have a situation where your blood pressure stays at a level that is not associated with symptoms.
Mhm.
And that can only be done with close monitoring of the doctor and you, taking your pressure at home, monitoring it, and sharing it. Shirley Johnson. Shirley?
Unmute, Shirley.
Okay.
My mom was 89 when she passed away, and they had her on like 13 pills a day. And she was just totally confused. And the one pill, one of her, and she had like three or four blood pressure medicines. And there was one that she needed to take in the middle of the day, and she did not take that often. When she had the stroke, it was, it was right during the middle of the day, but it's all of these pills that they give you. So it would be nice if they had a quad pill or something like that. That because after a while, my mom was to the point she would say, I'm going to stop taking all of these. I said, if you do, you got to keep taking your blood pressure medicine. They put you on so many meds that it gets very confusing as you get older and everything, or you're just tired of taking so many pills all day, every day. And I always wondered if she had taken that small pill, and I noticed because I had to pop out, I had her meds delivered. And so they pop them out. And I noticed that that's the one because she thought it was insignificant because it was so small. And it probably was the one that she needed to be taken more so than the others.
Thank you so much for sharing. Appreciate it. Catherine, you had a comment?
I was just gonna say, Carol had asked how long do you take it, and my dad had blood pressure problems when he was in his 20s, and so he took the medication into his 80s. So I don't think you stop taking it, and you have to take it in order to keep some people's blood pressure normal. You have to take it.
Thank you for sharing, Catherine. Lucy?
Good reason to take somebody with you, to have your person who can hear and who can advocate for you. Because the relationship is the a good doctor wants to work with you, to make it work in partnership. And we really need to get back to that kind of medicine.
Well, it's interesting to hear all these conversations because it just convinces me that we need more programs like this that educate the community so they're able to wrestle with their health, with their diets, their exercise, and all of these things. And we don't have enough programs like this that go into the community to educate and empower them to keep their health up. And this is one of the things that I think we need more of rather than less of. Carol and then John Buchanan again.
Remember when we had the geriatric doctor and he was saying that as you get old, doctors are prescribing too many medicines for us. And that I was relating the same thing like what Shirley was relating. And then Mama was having things to go like with the menopause and things that she didn't have problems with, but they kept requiring. And she finally found a doctor that took her off of all those medications. And you're supposed to adjust them as you get older. You're supposed to have less strength as you get older, or something like that. The geriatric doctor, and maybe he can come back on again since this is a group. But regular doctors, not regular, but if they're not with geriatrics of older population, they're not knowing how to prescribe for our generation. And they are, with studies that show, they are prescribing too many medications and too much for our generations. And even like eye medicine was causing a problem. And that was a wonderful talk that we had for the geriatric doctor that really understands that our body is not the same as when we're younger.
Thank you for sharing. Joyce?
Yes, that's the exact thing happened to my mother before she passed. Her um doctor, who was an elderly man, he had passed, and she got a younger doctor. And when the younger doctor looked at her history and her chart and her medications that she was taking, he realized that she was taking too much medication. and he took her off of one of her blood pressure pills and some other medications that she was taking. So yeah, I truly agree that older doctors are not in tune as the younger doctors are.
Well, and Carol was talking about a specialist, a geriatrician, who specializes in taking care of patients who are over 65, and I think that there aren't many of them, unfortunately, and so many of the older patients don't have the joy of having a geriatrician, but that's something that is desirable. John, last comment.
Yes. Again, with my mother, I think she was like 88 at this time when the Alzheimer's started to kick in. And, I went in the bedroom and she had her pills in a drawer, and the pills were in a box. They weren't in the pill bottles anymore. So you couldn't tell one pill from the other.
Wow.
And she had pretty much stopped taking her medication because she got confused
Mhm.
by, so I had to go through. I had to take pictures of the pills, look them up as Darryl would have done on Google, and found which pill goes where, and
Wow.
got her back, on a routine. I mean, she was very neat. I mean, they were like all of them were in this box, all together. You couldn't tell one from the
Mm.
other.
Thank you
Thanks.
for sharing, Darryl.
Yeah, I just did a search on can you get better treatment from a doctor who has the same diseases that you have? And the internet says, yes, you can, because you can get better, more empathetic, more personalized care from a doctor who's experienced the same disease. So I want a doctor that's in his 70s, has hypertension, that has an ablation that cured his AFib. I want a doctor just like me. I mean, I'm not a doctor, but same diseases.
That's interesting. Thanks for sharing, Darryl. Thanks for sharing. Okay, let's go to the next article. We certainly uh, took care of the quad pill. We're associated with a barrage of articles about aspirin. Aspirin, if you don't have cardiovascular disease, can cause bleeding. Now we see that it's associated with lower colorectal cancer risk and ischemic bowel disease, and in general with colorectal cancer risk. And so the question, what is it safe? You must answer the question. Is aspirin safe? And you see so many different articles talking about the good and bad and the ugly of aspirin that it is clear that it has many benefits, but it also has many side effects. And so if you have no cardiovascular disease, there isn't a place for aspirin for management of cardiovascular disease if you don't have it. But if you, uh, but aspirin has seemed to uh, been identified with a lower colorectal cancer rate. So, uh, what do you do? This is the question that many doctors have to try to answer. Cardiologists say one thing, the cancer specialists say another. And so we're having to wrestle with this issue, the protective effects of aspirin against the bleeding side effects of aspirin. And it is true that it does have side effects that are associated with increased bleeding in the brain. But it's also true that it's associated with low colorectal cancer rates. So what do you do? Who do you trust? Who do you pay attention to? One thing is clear, though, if you have cardiovascular disease, that it does have some benefit, but it also has the risk. So it's a decision that has to be made in conjunction with your doctor in terms of what's best for you. And that's where Darryl's identification of a doctor who's got the same problems you have may be helpful. Uh, um, so this is an article that is very new, in that you have a way of gene editing that lowers the cholesterol by giving an IV administration. And this gene editing therapy, which is brand new, by the way, is something that in the long run may replace the statins and the other medications that are used to lower the cholesterol level. But this is the first article of its kind demonstrating that gene editing can lower the cholesterol. And the question is, what's the short and long-term side effects of that? And we don't know yet because this is brand new study, but it's food for thought. And down the road, we may find ourselves taking an IV to lower our cholesterol levels and not need the statin medication that most people take. So this is a brand new finding, and as such, the role of gene editing is coming to play in many areas. So we got the GLP-1 drugs, and now we got gene editing drugs that are doing wonders. So this 21st century is a sight to behold. Any comments, questions about this? It's a new era we're getting into, and it seems to me it's becoming more and more evident that we need programs like this one to be proliferated across the country so that people can be able to help take care of themselves. Community education is power, and education is power, and
We also, we also need more Black doctors, more Black scientists who put us in the right arena for this type of treatment.
all of the above. Okay. Any other comments or questions? If not, we go to the next article. Here we have now a brain implant. Boy, I tell you, what's next? Parkinson's disease is a disease that affects many with inabilities to walk, inability to swallow, and many other aspects of it. We now, for the first time, have a brain implant that may affect the gait of a person who has Parkinson's disease. But this is early on, so it's too early to get a brain implant now. But there's a promissory note that over time, with this ability to monitor the brain waves, that down the road a piece, we may be able to affect the Parkinson patient who has rigidity, walking, inability to swallow and aspirate, and actually dies from pneumonia that occurs as a consequence of this brain disease. And so this brain implant may just be the beginning of what may result in the ability to monitor and control the ways in which Parkinson's disease eventually will be managed by a brain implant, conceivably. So this may be just the beginning of what may well be a way to address Parkinson's disease. Do any of you have any family or friends with Parkinson's disease?
I have a friend. In fact, I have two friends that have Parkinson's, and it's it's very upsetting to me to see their uh, hands shaking. Uh, you know, otherwise they're fine, except they don't have control over their functions. Sometimes they can't hold a glass of water or whatever because they'll spill it from the shaking. So yes, anything that can help with this, I think it'll make me feel better. You know,
That's just the early stages of Parkinson's disease because later on it affects the ability to walk and then it affects the ability to swallow. And down the road, they often wind up developing aspiration pneumonia, which is lethal. Dr. Perez and then Carol Tatum.
Heartbreaking, just absolutely heartbreaking, and hope is on the way.
Well, it may well be. Let's hope. We hope that this implant may be helpful, but we don't know how long it'll take for them to be able to get to the stage where it really is helpful. It's not helpful yet, but it's a promissory note. Carol Tatum?
Okay, I may have missed it. What's being implanted?
The brain, they don't tell you the nature of the implant that they put in the brain, but they do say that this implant allows you to monitor the impact of uh, the the way in which you walk, the way in which you talk, the way in which your hands move, and so uh, there's little information that is shared in how they do the brain implant. It's merely just to indicate that this is a new technology that may allow for us to monitor the brain waves that occur with Parkinson's disease.
Okay, so what I'm wondering is this a device, mechanical, or part of the brain that's being implanted in the brain?
No, it is an implant. There's a there's a there's a manipulation that is put in the brain.
Okay.
Okay, and that allows you to monitor what's going on with the brain when Parkinson's patients move their hands, their feet, and this, they believe, down the road will result in being able to affect the way in which the Parkinson patient's hands and feet move and the way they swallow, etc. So this is an early intervention that right now has no benefit, but down the road may well have a benefit. Next article. This will be the last one, I guess. It's amazing that what people think that vegetarians and vegans would uh, be stunted in their growth. And so I don't know where it came from, but anyway, the studies clarify that vegetarians and vegans are not likely to have stunted growth. I don't know where the thought came from, but it's certainly clear now that vegetarians and vegans, whatever age they begin, are not going to have stunted growth. So this is an important article for people who fear that babies who are vegans and vegetarians will have stunted growth. Okay, I think that's the last. Darryl?
Yeah, some time ago in the last 6 months, we were talking about how to build healthy immune systems with children. And if you remember that conversation we were talking about,
Yes.
it could be beneficial for, eating the mud pies, eating all the
Yes.
nasty stuff to build up immunity.
Yes.
So, I'm a vegan. I don't have children, but if I did, just in the interest of immunity, I would kind of recommend feeding those children all the nasty stuff every now and then. Some good old red meats, some butter, some some cream, just every now and then, just so they get the immunity, but they don't get all of the obesity that turns into all these chronic adult diseases.
Thank you for sharing. I guess that's the last article. Carol, any closing comments? Thank you so much for attending. What a good discussions we had on a number of subjects today, especially about death and dying. So, any closing comments, Carol?
Dr. Callender, we have a new member with us today. Our name is Shirley Johnson. I had the privilege of meeting her, and maybe Kathy wants to. That's a good college. Kathy and I went to high school and college together, but maybe she can introduce Shirley, and then Shirley has something to say.
I'll
Kathy,
introduce Shirley. I'm trying to see. I'm back on camera. She is a close friend and sorority sister of mine. She is in Florida most of the year, I should say half of the year. She's from Indianapolis. She studied at Meharry, and I'm going to let her tell you what she did in her working career.
how about that? Tell us, Shirley. Shirley, you still with us?
Still with you. I'm here trying to manipulate on my phone. That's one thing. Technology is not my forte. I am retired, but I worked in transplant, solid organ transplant. I was a histocompatibility specialist for 28 and a half years, and I might have even met you because when she mentioned your name, Carol mentioned your name. Seemed like you came and gave us a lecture one time. It seems like it. It seemed like I've met you before.
Yeah.
Yeah.
As a matter of fact,
Yeah, through Methodist Hospital and IU Health. And so I worked for IU Health. It started out as Methodist, eventually Clarion, all of that. But yeah, I worked in solid organ one while. We did, we also did bone marrow transplants and stuff like that. And then we kind of separated off into the two. But it was the joy of my life. The only reason I retired because I just couldn't be taking call for 20 some hours at a time sometime, or when you got 4 donors and you got all of those organs to to work up and everything. But I'm glad to be here. Very interesting conversation. And when Carol told me, and Catherine made sure that I didn't miss it this morning. She just called me and told me that, you were on. So I look forward to getting in and listen to more of these conversations and very interesting information. Thank you so much for allowing me to be here.
Thank you for joining us. It's a pleasure. I'm a Meharry graduate as well, so it's good to have you. Okay.
Put your email in the chat for me, Shirley.
Okay.
Dr. Callender, before we go, I just want to share some personal good news. I became a great-great-grandmother last Thursday. So I started a new generation of my family. So I am overjoyed.
Congratulations.
At 81.
Congratulations.
Very proud.
Congratulations.
Thank you.
Yes. We're happy.